1.8 million people are addicted to painkillers. Codeine, Vicodin, Oxycontin. These are prescription medication commonly used for pain management and can quickly develop into addiction. More than 115 people in the U.S. die after overdosing on opioids every day. The Midwest region saw opioid overdoses increase by 70% from July 2016 through September 2017. Overdoses has been seen all across America. Our blue-collar communities were hit the hardest. However, victims are now seen throughout all economic, social, and racial classes. America's appetite for drugs, fueled by Mexican cartels along with high unemployment rate, has contributed to the nationwide epidemic. Perhaps the largest contributing factor to the opioid problem in America has been caused by the pharmaceutical and medical industry. Poppy plants for pain management and other ailments date back to 3400 BC. It rapidly spread throughout Europe and Asia. In 1803, morphine was created. By the 20th century, heroin was legally marketed as a less addictive alternative to morphine. Since the 1990s and the approval of opioid use by the Food and Drug Administration, opioid abuse and addiction has been on the rise. Opioid side effects were apparent from the beginning, but the powerful pharmaceutical industry continued to market the drug as non-addictive. Opioid has been not only found to be highly addictive, but with long-term use, side effects such as depression, sexual dysfunction, fatigue, and heart complications has been reported. Continuous use has proven to decrease the body's natural ability to manage pain. As a result, it increases the patient's sensitivity to pain, which reinforces the physical dependency on the drug. We must do our best to educate ourselves and the community to prevent future drug epidemics. Active participation in electing leadership on local, state, and federal level is crucial in the health and prosperity in our community and country. The misuse and abuse of opioid use has caused the death and overdose rate to nearly quadruple between 2000 and 2014. Federal and state officials have implemented policies and programs aimed at the public crisis. The crackdown on prescription opioid is a direct result of our current heroin epidemic. Heroin is pharmaceutically similar to prescription opioid, as they both derive from poppy plants. Drugs drive addicts to a life of criminality in order to fuel their drug habits. Communities begin to deteriorate as a result. The epidemic is a community problem. If you know anyone addicted to opioids, check your local resources for help. There are many ways you can help. Contact your local opioid treatment facility or support group. If you want to help, consider donations or volunteer work. Many times, local churches is an excellent resource if you're looking to actively get involved. Additionally, active petitioning for changes in policy is important for the future of our community. It is easy to look away from this growing problem and remove yourself. Do not wait until you, yourself, or a loved one is affected by this epidemic to start taking actions. Millions of Americans are at risk, and we need to come together in order to make an impact.